Good morning, everybody. Today's episode with doctors, Dr. Fan Fucking Tastic and Dr. India.
Dr. India. And he has great advice. So if you're looking for great advice on any subject, he'll field the medical ones, I'll field the mental ones. And
Well, I can do both.
do both. And the physical ones of are there aliens in the universe, things like that. Call 310-913-5533. The phone line's open. We have a switchboard operator manning it now. No, we have 3 switchboard operators because there's so many people that call in with questions. We have to field them first, and if they're sufficiently interesting. Oh, here we go. I got our first caller. Caller, you're on the air live with the doctors. Oh, hold on. I'm very happy that you were able to get through the screeners with your interesting questions.
Great, me too.
Good morning.
Good
Oh,
morning.
we have some familiar lady from day before. Your sister,
Yes,
right?
this is Leslie.
Nice meeting you,
I have-
Leslie. Good morning.
Good morning, Vic. I have more questions.
Good.
Wonderful.
By the way, before you have your questions, Starseed report was extremely interesting. This woman does a lot of research. It's called Starseed Report, and she reports from things all around the world, what's going on. And
With the Earth volcanoes.
yeah,
And
climate
Hail-
change, disasters.
hail-
I see.
But I was thinking of
Earthquake also?
putting it on my app, and then it's all negative news. So what am I thinking? I want a feed that's all positive. People telling us what great things are happening in the world. So what's happening in your world, Les?
Well, I just think as an environmental activist, I just feel that it's important for us to know the weather patterns that are happening and the volcanoes that are erupting and the quakes that are happening, not just in the Ring of Fire. So, but anyway, this is about this new form of medicine that I'm very interested in, that I'm hoping you're going to bring to all of us next. Vic. So, right? Vic, Victor?
Yes. Yep.
Yes. So,
Vikram.
Vikram. Yeah, I knew it couldn't be Victor. That's an American name. Vikram. With a T-R-A-M?
K.
Vikram?
Vikram.
Yeah.
Vikram, I believe, right?
Vikram.
Ah, Vikram. Okay. So, Vic, what is a pathologist? They do what? They look at the blood? Is that
Wow. This is very interesting question. It's so basic, but yet so interesting because I'm telling you, 99% of the population is not aware. I'm talking about other than medicine. Population, lay people.
Can I try to field it first, and then you
Sure.
correct me?
Sure.
The pathologist is the person that studies your blood to tell you what's wrong, but he doesn't have the time to tell you, so he hands it off to the doctor who gives you the good or bad news. And it's simple.
You are
On a layman's
partially correct.
on a layman's term.
Second half was very much true,
Okay.
but that is not only applicable for blood, but for any tiny
Right, that's-
molecule and cell in your body.
Studying what's wrong.
Yeah, study of diseases and the cells.
The nurse takes your stuff, hands it to the pathologist. The pathologist checks it out, hands it back to the doctor, and he gives it to you. So everybody makes some money.
right? But the pathologist is who interprets what the
Yes.
doctor that reads off the damn piece of paper.
No, that's
Right,
not,
exactly. That's
Well,
that the doctors are the doctors. They just read from the damn piece of paper.
they're
That's
telling
correct.
the pathologist is what's doing all the work. The doctor's reading the results.
Right.
Correct. He's reading the results and deciding treatment. That treatment which we know at the time of making diagnosis, because without that we will not stamp our diagnosis.
So a very important position.
Without that, you will not. What diagnosis stand for diagnosis? Without that, what did you say?
I'm saying we make diagnosis, right?
You do.
Yes,
Pathologist.
but
Yeah.
that is required for the further management, correct? Now every
Right, and the
pathologist
management-
is aware about the of each diagnosis, so they have to learn management as well. So So if physician is knowing diagnose how to make diagnosis and management both, that person is more holistic doctor, correct?
Right.
Because that person has understanding of basics and the clinical aspect. While clinical
Right.
doctor, wherever you go, any specialist, either it may be lung specialist or cardiac specialist, whosoever it may be, they will just use our findings, what we give them, to integrate into management. They
Right.
treat patients. Now I'm telling, to actually make diagnosis, you need to know the treatment management plan. So we know everything, and we practice everything. Versus you meet any doctor, that person might be either brain doctor or heart doctor or lung doctor. But as a pathologist, you practice everything. You
Wow.
So it's integrated. So
Very important.
pathologist is the only physician who practice basic sciences as well as clinical sciences throughout his lifetime.
I hope it pays very well.
Well, that's not equally true. Well, it does pay enough if you compare the spectrum,
Okay.
but not worldwide.
Oh.
Yeah, right. Because some people probably just think of the pathologist as the lab guy.
Yeah,
Right.
and the scientist guy who does like, and sometimes they know at the most he's the guy who look at the microscope.
Right.
And often
So-
people have myth that my sample goes in somewhere in the lab behind the door and comes back with the result.
Right.
They don't know what are the things required and what
Yeah.
takes
Involved.
yeah what it
Right.
takes to get even simple one urine result or blood blood report.
Right. So the pathologist, like, you're right. We don't understand this, and we don't understand, like, even all the things that you do with the blood to test it with this, to test it that way,
Yeah, I
to
got-
find out
I got my-
this is the problem, right?
I got my blood test back. I couldn't believe
Right.
how many things were on that report.
Yeah, so exactly. So there are
Unbelievable.
billions of parameters, and this is not only blood. Blood is one. We in pathology more than 20 subspecialty we have, and we have
Ah.
expert in each area. So we are expert. We are subspecialist. Means we are not just specialists. We are subspecialists. We even focus in one area, right? But if you ask any general pathologist, that person is specialist. He knows everything, because we call anatomic pathology. So let's go back to basics. What that pathology and what kind of pathologists we have, right?
Yes.
So pathology,
My next
definition
question.
of pathology is study of cells and diseases.
Oh.
Got it.
Okay, so that means it's together. Or simplify, you can simply study of diseases. So the one who knows cause and effect. Okay, so we are the one who study cause and effect. Now, since we do not have enough pathologists, we have in each area small area, small topic, we have PhDs. Those are scientists. So to in a bigger umbrella, body is made up of tissue and fluids,
Right.
right? That's a general umbrella. So all the
Yeah.
tissue component is considered anatomic pathology, and all the fluid component is under clinical pathology.
Ah.
Okay, now there is a borderline here. There are some cells shed into fluid, like if you have fluid around your lungs, fluid around your belly, fluid around your brain. So we have cells shedding from brain, from lung, from different organs in the belly, right?
Right.
And also in the joints, everywhere we have fluid. So that is called cytology, which is right in the middle of these two branches: tissue branch,
That's
which is anatomic
what?
pathology;
That's called what?
cytology, cytopathology. Cyto means cell.
Cyto?
CYTO?
Yeah,
Cyto.
CYTO, cyto,
Oh,
pathology.
cyto, not psycho. Okay.
No,
psycho.
not psycho. Oh my God. Sorry for my bad English.
I'm in psycho, and I'm like, what? You call that psycho? No, cyto.
No,
CYTO,
cyto.
got it.
Cyto.
Cyto.
Cyto means cell, related
Yeah,
to cell. Yeah. So
I get
cytopathology
pathology.
is part of anatomic pathology because it's primarily cells from the tissue. Even though
Right.
even though those are in the cell.
Fluid.
Yeah, in
Right.
the fluid. Sorry. So anatomic pathology has now various branches, such as forensic pathology, which everybody
Uh-huh.
knows. Autopsy people do dead body. So some people have understanding. Oh, pathology only, cut dead bodies.
Yeah, for TV, right? The detective show, right?
Yeah. So no, we do much, much, much more even before even person dies.
I have a quick question.
Of
Pathology.
course. Also, we also, because then they won't die.
How do you break down that word pathology?
Patho.
Patho.
Logic. Logic means knowledge.
Oh, knowledge.
Okay. Patho means yeah.
Yeah. Did you study in school the Black Plague?
Black plague.
Yeah, the bubonic plague. It was a.
Oh, bubonic plague. Yeah.
You studied that?
Yeah. Yeah.
Yeah, I talk a lot about that because that's where the question, how are you, come from.
Oh.
Right? And a third of the world
So we
died.
call bubonic plague.
Bubonic plague.
Guys,
Leslie, do you know how the bubonic plague, which killed a third of the world, started?
No.
Okay, yeah. Basically, an idiot. I can't think of a worse word. I mean, I'd like to think of a worse word for this person. He was Pope Gregory the Ninth, a pope, and he thought that cats were the devil's worship. So he ordered the extinction of all the cats, and they killed all the cats. And of course, the rats proliferated with the fleas, and which spread the bubonic plague, and it killed a third of the world from his idiocy. And that's a pope.
Right.
You'd think if a pope would have a brain, right?
Yeah.
That's why I don't
Okay,
talk
I
religion or politics.
But there are
But
three.
Monty,
Yes.
that we're doing the same thing with using pesticides and insecticides to kill bugs. So we're doing it too right now with the chemistry and.
Oh, well, humans are screwing up big time, no question.
So I want to go back to
Yeah,
Vic
question.
explaining pathology. So
Yeah.
we're back to the cytopatho, yeah.
Yeah. So
pathology.
we have anatomic pathology, and we have clinical pathology, and in between understanding cytopathology, which is under the umbrella of anatomic pathology. Now, anatomic pathology has major other divisions, 4 other divisions. One is called surgical pathology. Second one is called forensic pathology.
What was the second one?
Forensic.
Forensic. Third thing, neuropathology.
Neuropathology.
Neuro,
Yeah,
brain,
neuro.
No, yes.
neuro. And fourth part is cytopathology.
Got it.
Okay, now surgical pathology, that's another 15 to 20 divisions.
Jesus. I mean, oh. Okay.
So, 15 at least. I would say generally at least if you consider major, but they also subdivided further. Like any organ you see from top to bottom, including eye, you have brain. So we have each pathology separately for that.
Wow, so every part of the body has a different.
Yes, because every part has cancer and every part has its own diseases.
Wow.
Correct? So now
That's
pathology
good.
is made up of
Nobody
all
can
the
learn all of
specialists. Exactly. So pathologist is the one who integrates all the specialty into their practice. So
To the what?
pathologist is the only physician who integrates all the specialties
Wow.
because he has knowledge of ophthalmology, he has knowledge of cardiology, he has knowledge of gastrointestinal, he has knowledge of reproductive biology. Because we have to decide for the diseases, we will not learn without learning anatomy. We will learn anatomy and physiology together to understand the disease process also. So if you learn anatomy and pathology, what is left? Biochemistry. And biochemistry is the one we use to pinpoint some of the markers we decide for the staging of cancer.
Right.
Right? So that means we have thorough baseline understanding of everything, even though we may not know on top of the head, but we will relate quickly.
I have a quick question on cancer. Have we had cancer throughout the ages, or is that a new
No,
thing?
throughout the ages.
Throughout the ages.
Right?
But they didn't know what
right
it was.
the time when baby is born, you can have blood cancer, which is called acute lymphoblastic leukemia. So before I move on further, so surgical pathology has, we call ophthalmopathology, we call ENT pathology, head and neck pathology, we call endocrine pathology, that means all the glands, thyroid, pituitary, parathyroid, pancreas. We call breast pathology, That means all the breast cancers under one roof, where specialists will do only blood cancer, breast cancers each day. Then we have cardiothoracic pathology that includes lung and heart. We have only lung pathologist, thoracic pathology. We have cardiac pathology separately. We have musculoskeletal pathology. That means all the bones and muscles. We have bone marrow and blood pathology. That means hematopathology, which is what I'm practicing. We have gastrointestinal pathology. That means we have all the intestines right from the mouth till the anus. So even in that, we have separate oral pathologies, which is part of oral maxillofacial pathology. We have liver pathology, and we have this intestinal pathology, which includes from esophagus to anus. We have GU pathologies. That means that person knows kidney pathology and bladder pathology, but that has varied myriad of pathology that has benign and malignant forms. So some people practice only kidney and bladder. That means they will not touch cancer, but kidney itself has a lot many diseases without even cancer. And there is cancer pathology who will practice mainly cancer, but he will also know medical part, means without cancer part of their kidneys. We have reproductive pathologists. That person has knowledge of basically GYN, gynecology, or uterus, ovary, testis, all this tumor of that. And we have skin pathologists. So these are the major surgical pathologists, in addition to neuropathology, forensic pathology, and cytopathology.
How many pathologists are there at UCLA, would you say?
We have all of them. But,
all of them?
But general population does not know.
Wow. That's a lot.
They just think that the sample goes in and come back with the result. And something fucks up, it's somewhere in the lab. But they don't know. In the lab, you need team of people who are working for all the patient. But good part out of that is, since we do not interact with the patient, we maintain our objectivity in our diagnosis.
Doesn't disturb you. You're focused. Yeah, that's good.
We maintain objectivity. However, nowadays world is full of rules and regulation, plethora of information we have. Now it's a high time that these people need to be in front, in parallel with other task force, other health professionals. So we.
Now, let me ask you this: how do you all communicate? Because there's so much information coming from Finland or Sweden, or there's so much. Discovering so much. How can you keep up with it all?
Exactly. So now that leads to another part of answer which I didn't finish: clinical pathology, which has microbiology, which has clinical chemistry, which has transfusion medicine, blood banking, which has immunology, which has molecular pathology. You hear me, right? Mm-hmm. So now, this all branches are overlapping some or the other way. They meet somewhere, right? But where they meet? They meet only when the disease is in uniting them. That means you have certain disorder or disease where you would require knowledge of molecular pathology and blood cancer. Sometimes you require knowledge of brain and blood cancer.
And there's a database where you can talk to all that person at UCLA and say, this is what I found out.
Yeah, so we have internal system where, of course, we are under the umbrella of pathology and laboratory medicine, so we have offices next to each other. But it's very important that each faculty has some additional expertise to bring on the table.
Right.
Like in my case, I have blood cancer and I know cytology. So cytology, these are two my areas.
What was the second one?
Cytopathology. Cyto,
oh good, okay.
Cyto, the cells.
Yeah.
So the cells which are shed from the different organ. So basically I'm the person who are more into cells, like blood cells and all other cells of the body. When they're loose and it's like you have a structure, of course you can recognize if you work hard, but if your structure is disintegrated and it's somewhere loosely spread everywhere, you need to figure out where that came from. Right?
Well, but I mean, knowing the cells in the blood, I mean, that's kind of like the basic one because that goes into all the tissues and,
Yeah,
I mean,
that's a
the
supply,
tissues are
correct.
made of the cells.
Yes.
The tissues are made of the cells. The fluids are made of the cells. The
Yeah,
food cells.
that's very good understanding you, and that's interesting question. That will lead to interesting question. So you have certain cancer like lymphoma in the breast. You can have lymphoma in the brain. You can have
Right.
lymphoma somewhere in the belly. So that means the person who is expert in the brain or expert in the belly, he needs to recognize cells coming from blood also, correct?
Right.
The same way, other cancers, all the cancers go into bone marrow also. Cancer, metastatic cancer from kidney spread into bone marrow. So as a blood cancer specialist, I need to know and how to recognize those cells as well,
Of course.
right? So
And
that,
that's from your eyesight to see it. You have to actually
yeah,
recognize it in a
yeah,
microscope, and you know what
exactly.
it looks like.
Yes.
And there's lots of looks.
Yeah, and we confirm because we have to
Wow.
maintain objectivity. So
You
we,
have a chart that shows all the.
yeah, we have a
looks.
chart
Well,
of different markers where this particular cell from origin of kidney will have certain markers. Markers means the surface of those cells has
identify it.
certain molecules which are peculiar to that organ, because that's how our body is developed, that we have common called pluripotent stem cell which differentiated into different organ, and that each organ will take its own responsibility and have environment to create same organ in amongst across all billion population, right?
Quick question: is a computer going to take this over?
Yeah, I was about to think that you would ask that question. Now there's hype of AI, hype of AI. Actually, the good part of AI and the myth about AI. So first of all, let's talk about myth that it will take over. No,
I don't know.
no.
Good.
However, it will be immensely useful for us
Yes.
to reduce our workload, where we are focusing on the damn required thing rather than going from the ground and taking things in our hand and waste sometimes unnecessary time. When I
Right.
know that something is reproducible, you can manage to get it help from technology. Why not? So, but of course, there is one interesting aspect of pathology. Any doctor expert, he's doing some procedure and removing tissue. So he removed tissue. He just removed piece of tissue, not like entire organ,
Just
right?
a biopsy of
So
it.
when you make first diagnosis, before you even tell patient you have this and that, you cannot remove entire organ.
Right.
You have to make diagnosis
piece
on the
of it.
tiny piece of tissue.
Tiny piece.
And then what we have on
And
the,
that doesn't mean the other piece isn't. Will be
yeah,
affected.
exactly.
Yeah.
So other piece might have tissue which other the sample tissue does not have that.
Right.
So those cells, right, or those
Because
changes.
it's a big. It's a
Yeah.
big organ. Yeah.
So it's a 3D dimensional.
Well, like the lungs. It's huge lungs.
And now the same aspect. Now now there are many variables in that. The way you sample the tissue, the way you process that, you spread on the microscopy slide, the way you recognize that, and there are variables play around. Even though you recognize, sometimes you missed some of the things because you were distracted or you were unhappy, you were sad, whatever it might be.
Human.
Right?
Exactly.
Human.
We're human.
It's a human factor which nobody will know. Now, if pathologist is the last person who will make a call whether you have cancer or not, one has cancer. Oh, well, not you per se. Sorry. In general,
We know what
anyone
you
has
meant. We know
cancer.
what you
Yeah.
meant,
So, and if we make mistake, down the line, everyone else is making mistake in terms of management.
Yeah. It becomes
Now
happening.
we are behind the door, so we may not see that what are the dynamics of patient's life, and in hospital in particular setup, it's thousands of dollars.
Yes.
We make diagnosis sometimes in 1 minute, but we know that behind the scene, we are behind the scene, but that in the front is changing dynamics, which is actually thousands of dollar worth.
And human errors, all the errors that can happen.
Now, we try to reduce error, okay, but we are also sometimes in a dilemma where even though we have best intention, we either make error or,
Bring on to the tail. He just
yeah, exactly. So it applies to all dimension of life also, where people get misunderstanding. Sometimes they start with wrong presentation of themselves and people judge you. It applies in all dimensions.
Exactly.
Now in routine day to life, it doesn't matter. Okay, you don't like. Okay, move on to next, and you don't even talk to that person. But we cannot say that. We have to recognize what this shit is, right?
Right.
So you
But
try
you
to
say to make mistakes, and that's where the computer could come in, the
exactly.
AI, right?
So what we can well now computer is fed with millions of data of the similar pattern. However, now we were talking about sampling of the tissue, looking at the skin. That was in between. So you have to project your imagination because computer will not read what is not sampled, right? Like what I
Okay.
mean, if I have 10 sample or 20 sample, that doesn't mean all 20 samples were representative of everything. There is always variation. So what that translates in that general, in any particular specimen, if computer is recognizing something, okay, there is potential chance that there might be disease, which we have to believe because we trained computer. But computer doesn't know what is in between, what is not sampled. Sometimes some of the things you see is abnormal, but because of treatment changes, radiation changes, cells change their form, become aggressive with the radiation, but those are benign cells, normal cells. It's like you are a normal person, and there is another spectrum, another end, extreme end is terrorist. Now in between, you can have angry person who is in transiting to become terrorist.
Right.
So if angry, that doesn't mean you are abnormal. You are just angry.
I like your analogies. Leslie, we have to cut off.
Known. It's called internal milieu homeostasis. When cell needs to have environment to form this and that organ, they need to have signal to form and go this way, travel this certain direction, and so that's part of embryology. And also, I did not mention pediatric pathology. In pediatric, all these branches are divided again.
Okay, we're gonna have to hold this off till tomorrow. Leslie, call back tomorrow. Let's continue. This is fascinating. Hope everyone's learned a lot. Everyone, be fantastic. Keep your cells healthy. Keep your bodies healthy. Keep your minds healthy, and be fantastic. Right?
Yep, be
Have a
fantastic.
fantastic day, everybody.
Leslie, hold on
Thank
just
you.
a second. Yo, but
Yes, sir.
She's not on the camera.
No.
Yeah, you can cancel that.
Okay.